Here at KCTV5, we're honored to partner with Couture KC, a local organization that has helped thousands of women and men in the metro get screened for breast cancer, and they have helped hundreds more as they embark on the journey to fight breast cancer. Joining me now is Couture founder Sharon Butler Payne and a plastic surgeon who specializes in reconstructive surgery, Dr. Paul Leahy. My first question for Sharon, for people who aren't familiar with Couture KC, all the money, tons of it, goes to make sure women have a fighting chance at getting early detection.
That's correct. Couture KC has raised close to $1.5 million in our first 7 years. And this money is used to provide insurance for our supplies for uninsured and underinsured cancer patients. And one of the things that we do is we sponsor screening parties where we go into the underserved community and we pick up women who don't have insurance and we bring them to an imaging center to be screened, sometimes for the very first time.
You've saved lives doing that. Simply put, they save lives. You brought Dr. Leahy here to talk about an often under-discussed topic, reconstructive surgery, because Sharon, you're in the process of your third reconstructive surgery. Women don't talk about this. Why?
Well, I believe, and actually I socialize this, because we're 8 years old, I've now worked with over 150 breast cancer survivors. And so I socialize this with a lot of those survivors in preparation for this segment. And what we all feel is that at the time, you're focused on your cancer. You're focused on eradicating that cancer from your body. You want to be done. And you don't think about your reconstructive surgery. You sort of slip from your treatment right into reconstructive surgery, yet as my co-survivor Joy Campbell said, it is your reconstructive surgery that you take with you for the rest of your life. I would say the other element is that women feel vain. We talked about this last night we had our kickoff meeting with our 15 models for 2018, and you feel vain to be asking questions about how your breasts are going to look when you get through this process when you're bumping up against losing your life to breast cancer. I mean, how can you be talking about that when you're just trying to save your life? But once again, this is what you live with for the rest of your life. And so, yes, I'm going through my third and my very best. I'm very pleased with the results. This is my surgeon,
Dr. Leahy.
Dr. Leahy. And this time, though, because I wasn't battling cancer, then I came with a list of questions and I talked about what I wanted in my results.
And that's my question for Dr. Leahy. What do women need to be asking their plastic surgeons or potential plastic surgeons if they're interviewing many? What are the specific questions women need to ask about the shape of their breasts, how they want to look, things of that nature?
Well, thank you. And as Sharon so nicely said, it's our honor and our privilege as plastic surgeons to be a part of your team fighting this whole disease. So, but at that first meeting with us, it's just so hard. There's so much anxiety and worry and concern about what's going to happen later that I oftentimes don't know that they really grasp what we try to get across in that first meeting. And so usually my approach is just to provide hope. And so we look at pictures and sort of talk through the basic phases that will be breast reconstruction surgery, and hopefully they'll
And then you send them home with this video because it's hard for women to process, as you both said, and then they can look at this video and process it again and watch it with their families. And this is an example of what you send home. Yes. You also brought something to show our viewers, which I think is fascinating, and I'm hoping that you can take these out of this kit you have in front of us.
Definitely.
This is a new piece of technology that you're using at your office.
Yes, so this is a new product made by a company called Air Expanders or Aeroform. So the traditional way we would do breast reconstruction surgery is with mastectomy, we've taken away a lot of the skin and the breast tissue. So we want to stretch those tissues to be ready for the real implant. And so the traditional way is you'd have a device underneath those tissues, and then you come to the doctor weekly and they put a needle into the implant and we put in saline solution or air.
Which hurts.
It's
terrible.
Not comfortable.
It's like torture. You do that every week until you finally say, I'm done, I don't want to do this anymore because it hurts so badly.
Which again, it's a terrible reason to end something when it's something you're going to live with. So you have a remote control that expands those?
So now instead of using a needle traditionally, this device would again go under the tissues, but it has a little compressed cartridge of CO2 air. And so then the patient can go home with this remote control And 3 times a day, she just sort of waves it over the implant and turns it on. It's very protective, it's fail-safe, and then this process is a lot quicker and way more comfortable. So,
Dr. Leahy and Sharon, thank you so much for being here. This topic is so important, and we hope this conversation continues for you viewers.